Adson's, scalene-Andicus syndrome.
Okay, so basically what you're gonna do is you're gonna abduct and extend, and what I'm gonna have the patient do is I'm gonna have her look up and then look over at me, okay? I'm looking for a diminished radial pulse. If I do feel that scalene anterior, the modified to this is have them look away, and that scalene moves.
Allen's test, not a TOS test.
Allen's test is when you just basically occlude these arteries, have them pump their fist like this, and then one at a time you let that one go, make sure it fills, and then you let that one go, make sure that it fills.
Costoclavicular maneuver Egan's, costoclavicular syndrome.
So what you're gonna do is grab both of her arms, you basically pull her back like this, you're gonna have the patient flex their chin down like that. And I'm basically looking for a diminished radial pulse again, and that's positive for costoclavicular syndrome.
Halsted, thoracic outlet syndrome.
Halsted, all you're basically doing is just pulling down inferiorly. You're going to have the patient extend their head and look up. If there's no diminished pulse here, then you can have them actually look away from you, look to that side, and then you're looking for a diminished pulse there for TOS.
Reverse Bacody's maneuver.
Basically, yep, you just put their arm up like that for Bacody's, and it would trigger some kind of numbness, tingling down that arm for TOS.
Ruse.
Ruse, chicken dance for 3 minutes?
3 minutes.
3 minutes. Basically looking for numbness, tingling in the arms.
Wright's test, hyperabduction maneuver, pec minor.
Wright's test is basically you start here, check the pulse, check the pulse, check the pulse. Look for it to diminish at a certain point, maybe there. Go to the other side, see where it diminishes on this side. Positive or diminished pulse in this would be for pec minor syndrome.
Cool. Dislocations.
Okay, for the shoulder dislocations, you have A, B, C, D, and an H for Hamilton. So the first thing you do is an apprehension test. You can have them lay down on their back. Apprehension test. You're basically going to put them like that. They're going to have pain. You can confirm it by doing a relocation test. You go like that, and it would decrease the pain. So that's apprehension. Bryant's test is you're basically looking at the axillary folds. If there's a dislocation, one of them will be lower. Callaway's, I think circumference. So you basically could measure the circumference of the shoulder. It has to be greater than 1 inch on one side to be a dislocation. Dugas, when you basically put their shoulder up like that, and they can't put, they can't put their elbow back into the chest without causing pain. You can push down on it and it causes more pain. And then Hamilton's is the ruler from the acromion to the lateral condyle. It shouldn't touch.
Cool. Should they show apprehension on apprehension test?
They should show apprehension test.